You're walking through the shopping mall on Christmas Eve with your family and friends. There's crowds of people everywhere, they're happy, they're smiling, everyone's having a great time. But then, over the loudspeaker, you hear the chilling words, "Code Blue, emergency, CPR responders to the front desk immediately." The crowd of curious onlookers pushes you toward the front desk, and when you get there, you see an elderly man lying on the floor. His skin is turning a scary shade of grayish blue. You begin to panic. This man needs help, but you don't know what to do. As you look around at the crowd around you, you see the same panic on their faces that you feel in your heart. They don't know how to perform CPR either. All of you just must stand and watch helplessly as the precious minutes tick away, waiting for the ambulance to arrive. Situations like this can happen anywhere at any time, and it's important to be prepared. Often, a CPR responder is the only person who stands between a cardiac arrest victim and death. Each sequence of CPR only takes about 15 seconds, but it's 15 seconds that can change someone's life. CPR stands for cardiopulmonary resuscitation. It's a series of movements that artificially mimics the pumping of the heart and keeps oxygen circulating through the system. It's meant to be used for a few minutes while professional help arrives. Its roots stretch back to the 1740s, but CPR wasn't standardized by the American Heart Association into the form we know it today until 1960. According to the Duke University Medicine News and Communication website, CPR is often misrepresented as one of two extremes: either a miracle lifesaver that instantly revives and saves the life of everyone that you give it to, or a tragically futile attempt to stave off a certain death. In reality, CPR is neither of these extremes. Let's take a look at how to actually perform adult CPR and hopefully clear up some of the myths about this process. I am certified by the American Heart Association in adult and infant child heart saver CPR, so I can certify that this process is simple and easy to learn. However, don't use my video as a substitute for certification. For one thing, the Indiana Good Samaritan law only protects CPR responders who are officially certified by the American Heart Association. If you're not certified and you try to give CPR, you could get in big trouble, so be sure of your legal status before you start giving CPR. Now let's take a look at the process. This is my sister. She's agreed to help me. The first thing that you do when you see an adult lying on the floor and you think they may be going into cardiac arrest, first thing you do, shake them and yell and see if they can hear you. Are you all right? Do you hear me? Are you all right? Can you hear me? If the patient does not respond, immediately send someone to call 911. You over there, quick, I need you to go call 911. Tell them to bring an AED. An AED is an automatic electronic defibrillator. It's a device that sends an electric shock through the patient's heart to bring them back to consciousness. Next thing, it's time to actually start CPR. There are two ways to do it, with and without a mask. I'll demonstrate the maskless method first. Pinch the victim's nose tightly. Tip their head back so that their airway is open and there is a straight, open path of their throat from their mouth straight down to the lungs. Now pinch the mouth, pinch the nose, and make sure that your mouth completely covers the victim's mouth. I'm not going to do that in this demonstration, but make sure there is an airtight seal between your mouth and the victim's. Give 2 rescue breaths. Now you should breathe until you see the chest of the victim rise by about an inch or so. This is a medium-sized breath. Don't blow really hard, but make sure you can see the chest rise. After 2 rescue breaths, it's time to give 30 compressions. Put your hand out in front of you like this. Place your other hand on top so that the fingers interlace and close your top hand over the bottom hand. It doesn't matter which hand you have on the top or on the bottom, just as long as you're comfortable. Position yourself over the victim and place the heel of your hand on their breastbone. Now make sure you don't put it up too high or you won't be placing any pressure on the heart. Also don't place it down too low because then you'll break off the edge of the breastbone, which would be really horrible for you and would make the CPR not work properly. So place the heel of your hand in the middle of the patient's breastbone, usually on a line straight across their chest. Then you give 30 compressions with your full weight. Lean over so your full weight centers on your patient's chest. Now, don't try this in a simulation. Only do it in real life because you could seriously injure your buddy. Give 30 compressions at about this speed. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Counting while you give compressions not only helps you keep time, it also makes sure that you don't lose track. After the 30 compressions, give 2 more rescue breaths, making sure the chest rises 1 inch, and do 30 more compressions. Keep this process going until help arrives. When you're doing the compressions, make sure that you put your full weight on the victim's chest. This is how to do it without a mask. When you receive your CPR certification, you will often be given a CPR pocket mask kit. In this kit, you will have some supplies that are important to have in an emergency. 2 alcohol prep strips. These are like what you find at the doctor's office. They're treated with alcohol. They're used to prep a spot and kill germs. You can use these on the mouth or preferably on your equipment. Directions on how to use the mask. A personal antibacterial, antimicrobial wipe. This can be used to cleanse your face or the patient's face or anywhere that you need to absolutely effectively kill germs. Now, it's not a terminal sterilant, but it is pretty close. Latex gloves. In any emergency, there's the risk of bodily fluids coming into contact with you and your skin. Blood, vomit, other kinds of fluids. It's important to wear latex gloves to protect yourself from these fluids and the germs they carry. Then is the mask. To use the mask, you pop it out, which they are often stiff and should be moistened regularly in warm water to keep them supple for an emergency. Pop it out till it looks like this. Then place the mouthpiece on the mask and put it on tightly. Now, the reasons for using a mask are, the first one is obviously germs. It's very unlikely that you could catch something by giving someone mouth-to-mouth resuscitation, but it is possible, so a mask can make you feel much more comfortable on that. There's a filter in here that filters out germs in the airway, both from you to your patient and back again. And the mask also ensures that you don't get anything on you. A symptom of cardiac arrest is often vomiting. Obviously, you don't want someone vomiting on you while you're giving them CPR. The mask helps prevent this. To use the mask, again, after you have sent someone to call 911 and tipped your patient's head back, you place the mask over their face, their mouth and nose. There's a small arrow here that says nose. The pointy side goes over the nose. Now, I'm not going to push down with full pressure because my sister is awake. But you would place it over their nose, press with firm pressure with the heel of your hand while keeping the victim's head stable with your other hand. Then breathe into the mouthpiece. After you have finished and when help arrives, then you just get out of the way. And voila, she is revived. Unfortunately, it's not always that easy. Studies by Duke University and the American Heart Association show that while CPR doubles a victim's chance of surviving the initial cardiac arrest attack, it's not a miracle cure. Non-hospitalized patients have a post-CPR survival rate of 2 to 30%, and many survivors have brain, nerve, and tissue damage. However, don't let this deter you from giving CPR in an emergency, because victims' chances of survival fall by 7 to 10% for every minute that you delay in CPR. Promptness is the most important key. If you'd like to become certified in CPR or learn more, there are several resources that you can use. You can visit www.americanheart.org for the National American Heart Association website, where you can find a CPR certification site in your area and learn more about the CPR process. If you live near Lafayette, Faith Baptist Church of Lafayette regularly offers classes that teach CPR, how to use an AED, and first aid. If you live in Muncie, your local chapter of the American Heart Association and your local Red Cross both offer classes. As we have seen, CPR is relatively easy and quick to learn, and there are many local opportunities to become certified. I hope that I've cleared up some of the mysteries of this process and encouraged you to partake in the certification of this powerful rescue tool.